My name's Andrew Bain. I'm one of the dentists here at the Chelsea Dental Studio. I have been qualified since 1997, trained in Bristol, at Bristol University, and I've been in general practice ever since. Over the last few years I've taken a big interest in aesthetic dentistry, particularly in minimal aesthetic dentistry. So what that means is that I like to, first of all, align the teeth, then whiten the teeth, and then enhance the shape of the teeth. And by doing it in that way, I find that it's much less invasive to the teeth underneath. One of the main tools that I use to straighten teeth is Invisalign. Now, Invisalign is a very popular treatment now, and I've done an awful lot of cases over the last few years. Invisalign is a plastic aligner, a clear plastic aligner, which sits over the teeth. You need to wear it full time. You wear it 22 hours a day, and every week to 2 weeks, depending on the case, you change to another aligner, and you gradually straighten the teeth over time. So that allows us to put the teeth in a good position. If we don't like the shape of the teeth after that, we can then do either cosmetic bondings, which is little tiny bits of composite which we stick to the tooth and polish up, or we can do veneers, which are porcelain which we sit over the top of the tooth. They require a little bit more tooth reduction, but if you've already straightened the tooth, you can keep that tooth reduction to a minimum. We also whiten teeth when we're doing that if the patient doesn't like the colour of their underlying teeth. So I have a lot of patients who come in who have been afraid to smile. They don't like their smile. They either haven't had any tooth straightening or any treatment at all before, or they have had treatment and it's relapsed. So Invisalign is a really nice treatment. It's comfortable to wear. You can remove it when you need to remove it. You mustn't remove it too much though, because it won't work. But it's a pleasant thing to wear, and patients generally have a very good experience with it. It's not really a painful procedure either. It's a little bit uncomfortable for the first aligner, but generally they're just tight while they're in. They have to be tight, otherwise they're not doing their job. The other great thing about Invisalign is that we get to see what the result is going to be before we start. They have a software system which actually shows your own teeth move into the position they're going to move, and each aligner conforms to that shape that we've pre-planned. So patients can really see what sort of benefit they're going to get before they even start the process. Another benefit of Invisalign is that they are easy to remove and easy to keep clean. You can take them out and floss your teeth as you would normally, and you're encouraged to do so very much when you're doing something like this. It's easy to remove, you get very used to removing it, and while they're out you can clean your teeth as you would normally clean them. Patients also say that it reduces the amount of snacking they do, so maybe there's a little bit of a benefit there with dieting too. So if you've got anything at all in your mouth that you'd like to improve, if you'd like to have a brighter smile, you'd like to feel more confident when you're smiling, you want to whiten your teeth, you want to move the position of the teeth, you want a wider smile, anything at all, do come and see me, and I can give you my honest appraisal of what I think is best for you, in my opinion, and then give you other options before deciding what you'd like to do.